All right, today we're going to play detective. We're diving into a fascinating medical mystery, and we're going to piece together clues that stretch from ancient history all the way to a very painful modern day shoulder condition. Our whole investigation really kicks off with a super strange question.
So let's start with a real head scratcher. What on earth could possibly connect these massive sea reptiles from 250 million years ago with today's scuba divers? I know, it sounds like a riddle, right? But the answer actually uncovers a pretty serious medical condition that's been hiding in plain sight for, well, eons.
And here it is. This is our culprit. The link is a condition called osteonecrosis, which, when you break it down, literally just means bone death. It's exactly what it sounds like. It's what happens when bone tissue gets starved of blood, and without that blood supply, it just starts to die. It can happen in different parts of the body, but today we're zeroing in on the shoulder. And get this, paleontologists have found evidence of this exact condition in fossils. It's incredible. A whopping 16% of these ancient marine reptiles, called ichthyopurgians, showed clear signs of osteonecrosis right in their humeral heads. That's the top part of their arm bone, just like ours. So, this discovery really sets the stage for us, doesn't it? Shoulder osteonecrosis isn't some new disease of the modern age. It's a truly ancient medical mystery. And to solve it, like any good detective, we need to track down the suspects. So where do we begin our investigation? Well, let's start with the most obvious clues. The external forces. We're talking about things that happen to the body from the outside that can kick off this whole terrible cascade of bone death. First up, and probably the most straightforward suspect on our list, is severe physical injury. A really bad break or a major dislocation of the shoulder that can absolutely set the stage for some serious problems down the line. And this slide really shows you why that is. You see, the head of the humerus gets all its blood from this really delicate network of arteries, which you can see there on the right. Now, if you have a complex fracture, like that nasty one on the left, it can literally tear or crush those vital supply lines. And the math is simple. No blood flow equals no oxygen, and no oxygen leads to bone death. And the key thing to understand here is that the more shattered that bone is, the higher your risk. I mean, look at these numbers. With a 3-part fracture, the risk of developing osteonecrosis is as high as 25%. But with a severe 4-part fracture, whoa, that risk just skyrockets to an incredible 77%. It's a really clear link between how bad the injury is and the chances of choking off that blood supply. Okay, on to our second external suspect, dyspareunism. You probably know it by its more common name, the bends. And this brings us right back to our original mystery, the one about ancient sea reptiles and modern scuba divers. You know, the easiest way to think about this is to picture shaking up a can of soda and then popping the top. When a diver goes deep, all that pressure forces nitrogen from the air they're breathing to dissolve into their body tissues, especially into the fatty bone marrow. Now, if they come up to the surface too fast, that pressure drops suddenly, and all that nitrogen comes rushing out of solution, forming tiny bubbles in the bloodstream. These bubbles can create little traffic jams, blocking up the tiny blood vessels in the bone. But wait, there's another layer to this, and it's pretty surprising. It turns out that up to 30% of people, almost a third of the population, have a small, usually harmless hole in their heart called a patent foramen ovale, or PFO. Now, for most of us, it's no big deal. But for a diver with a PFO, the risk of getting the bends is 5 times higher. Why? Because those nitrogen bubbles can slip through that hole, bypass the lungs, which would normally filter them out, and go straight into the body's main circulation. All right, so we've looked at what can happen from the outside. Now it's time to turn the investigation inward, to look at the culprits that can start from inside the body itself. And this list of suspects looks a whole lot different. We're talking about things like taking high-dose corticosteroids, having genetic disorders like sickle cell disease and Gaucher disease, or even just heavy alcohol consumption. All of these can trigger osteonecrosis without a single external injury. So let's take corticosteroids first, because they're a really common cause. Now, scientists are still debating the exact mechanism, but the leading theory is pretty wild. It suggests that these powerful drugs can cause fat cells inside the bone marrow to swell up. This builds up the pressure inside the bone, what's called intraosseous hypertension, and it can literally squeeze those tiny, delicate blood vessels shut from the inside out. Next on our list is a really big one on the world stage, sickle cell disease. It's a genetic disorder that most likely started in Africa, possibly as a natural defense against malaria. And as you can see from this map, human migration over thousands of years has given it a massive global footprint, affecting millions and millions of people.
So what happens in sickle cell disease is that your red blood cells, which are normally nice and round and squishy, can become hard, sticky, and twisted into a crescent or sickle shape. Because of this abnormal shape, they can't flow smoothly, and they end up creating these little log jams in the body's tiniest blood vessels. And just like with those nitrogen bubbles, the result is exactly the same: blocked blood flow, and eventually bone death.
And you really can't overstate how big of a deal this is. When you look at the research, because so many people have it worldwide, and it has such a high rate of bone complications, sickle cell disease is likely the single most common cause of shoulder osteonecrosis on the entire planet. Okay, so we've got our lineup of suspects, we know what can cause this, but how do doctors actually crack the case when a patient walks in complaining about shoulder pain? Well, they rely on a combination of listening to the patient's story and using some pretty powerful investigative tools. They've got two main tools in their detective kit: X-rays and MRIs. Now, you can think of it this way. An X-ray is a good start, but it's often a little late to the party. It usually can't see the problem in the very early stages. The MRI, on the other hand, that is the undisputed gold standard. It is so sensitive and so specific that it can detect the very first signs of trouble long before the bone even thinks about collapse. And this side-by-side really hammers the point home. Look at the X-ray on the left. You see that little white line, the crescent sign? That's actually a tiny fracture right under the cartilage, a clear signal that the disease is already pretty far along. But now, look at the MRI on the right. An MRI can see those dark areas that show the bone is dying way earlier, giving doctors a critical head start on treatment. So, once a doctor has used these tools to confirm the diagnosis, the last part of the investigation is to figure out just how bad it is. This is called staging, and it's absolutely crucial because the stage of the disease basically dictates the entire game plan for treatment. Doctors use a 5-stage system to do this. In stage 1, the X-ray actually looks completely normal, but an MRI can already see the problem. By stage 2, you start to see some subtle changes on the X-ray, maybe some hardening of the bone. Stage 3 is when that classic crescent sign shows up, which means the bone is starting to fracture under the surface. By stage 4, the round head of the humerus actually starts to collapse and flatten out. And in the final stage, stage 5, the damage is so severe that you have advanced arthritis affecting the entire joint. And that staging system leads directly to the treatment plan. It's like a roadmap. If you catch it early in stages 1 and 2, you might be able to get by with conservative treatments like medication and just taking it easy. For stage 3, there's a surgery called core decompression, where they try to relieve the pressure inside the bone. But once you get to those advanced stages, 4 and 5, after the bone has already collapsed, well, the most common solution at that point is a shoulder replacement surgery. So there you have it. We've followed the clues all the way from ancient fossils right into the modern operating room. We've lined up the suspects, from sudden injuries to silent genetic conditions, and we've seen how doctors solve the case. The final mystery, I guess, is a personal one. Could one of these silent culprits be a risk factor for you or someone you know? Understanding the risks really is the most important first step. Thanks for joining me on this investigation.